Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Uses of atropine. Atropine is actually the drug of choice for mushroom poisoning. It is the drug of choice for mushroom poisoning. It is the drug of choice for sinus bradycardia or nerve gas poisoning. It is used as a reversal agent of AV block. It can be used as drug of choice for organophosphorus poisoning or sick sinus syndrome. It is a drug of choice for mydriasis, or it can be used as for mydriasis. It is used for mydriasis and cycloplegia, and this is longer acting. It works for around 7 to 10 days. So atropine produces both mydriasis and cycloplegia. It can be used for fundal examination. It is not used in adults because of this longer duration of action. It is used in children, and this atropine can also be used as ointment in eyes, that is 2% for fundal examination. So atropine will normally act for 7 to 10 days, so it is not used for adults. Then the other mydriatics are, we have homatropine, which is used, which has duration of 24 hours. Then we have cyclopentolate, which works for around 1 to 3 days. Then we have tropicamide, which is actually the shorter acting, which works for 6 hours. Shortest acting is tropicamide. So these are the anticholinergics which can be used for the mydriasis, for fundal examination.
thank you and thank you for watching.